Hi everyone, we've got Dwan here today. We're going to ask her a few questions so that you guys can get to know her a bit better. First question, why did you become a Myo?
I became a Myo because of me being a patient myself. So at about age 12, I got diagnosed with scoliosis, which is curvature in the spine. It was quite severe, and they wanted to operate. And instead of operating, I decided to go through physical therapy. So I had everything under the sun, and I found that a Myo helped me the most. I found that there were some gaps in all forms of physical therapy, and that it could be done, different. And so I decided I wanted to become a physical therapist to fill in those gaps and formulate a module that really worked for everyone. Myo I found allowed me to do the hands-on work, but also the strength and conditioning and the educating work as well. And that's why I became a clinical myotherapist.
Excellent. So given your background of your own body restrictions, what do you do now to stay pain-free and mobile?
I use exercise therapy the most, just because we're all treating at the same time. We struggle to treat each other. I quickly found out, though, that being active or moving, whether that's 30 minutes a day, keeps me relatively pain-free. I still self-treat using a spiky ball and foam roller, and then some self-mobilizing techniques, but I try exercise every day, whether that's running, hiking, strength and conditioning, using weights, F45 classes, whatever really motivates me that day. If something doesn't motivate you, you won't move. So there's no wrong or right with what exercise you use, as long as you're doing the exercise right, and that's a big part of how I treat.
Yeah, excellent. So just to clarify, can you explain to the people at home how you do like to treat?
Yeah, so when you have a pain complaint or a restriction complaint and you come in, I really want to know why your body is producing that complaint initially. So there'll be some sort of aggravating factor in your lifestyle, and we'll identify that and change it. I very rarely say no to movement. I keep everything pretty much the same except that aggravating factor, trying to getting your pain to a lower pain scale. I then introduce movement, increasing your movement, changing your posture, and treating your self-treatment techniques. Once that's all getting ticked off, I help with your strength and conditioning, making sure that you're not going to the gym and then flaring everything up again. Now, if that's your pain complaint, if you're someone that came in with a gym injury, well, then that's what we'll start with. We'll look at how you did your deadlift. It's a bit of a treatment plan. Everyone gets in a treatment plan, and it kind of runs in that way. Modality wise, there's massage, dry needling, cupping, joint mobilization, and a whole lot more.
Great. Final question, Dwan. What days do you work here at the clinic?
I work Mondays, Monday mornings to early evening. Thursday, I do a later shift, so like a 12 till 7. And then a Saturday, I work in the mornings.
Great. Thanks for your time, Dwan.
No worries.